Hello. I'm Dr. Williams. Welcome to this course. Click on Next to continue. Why we are doing this course. As healthcare aides, it's important to know how the clients that we care for may potentially overdose on opioids, and what to do if that should occur. And, it is important to be prepared to help not only our clients, but anyone that may be experiencing opioid poisoning. It's important to know that opioids can be prescription and legal as well as illegally purchased, and that ingestion can be either intentional or unintentional. Opioid poisoning can occur from use of illegal street drugs, and it can also happen in a care environments such as ours where clients may be administered opioids as part of their care plan. Therefore it's essential that we know when and how to use an Naloxone, nasal spray. Opioids are drugs that relieve pain and slow down body functions like breathing and heart rate. Sometimes they are called depressants or downers. Examples of opioids can include morphine, oxycodone, fentanyl, carfentanil, hydromorphone, heroin, methadone, buprenorphine, and codeine. Now, what is poisoning? Poisoning, or overdose, is when the amount of drug taken is more than the body can handle and causes harm. Poisoning is a medical emergency and 911 should be called for emergency medical services, EMS, to help. Overdose or poisoning can occur when opioids are taken in greater amounts than the body can tolerate, and puts an individual at risk of death or permanent brain injury. Overdose can happen with alcohol, over-the-counter medications, prescription medications, illegal substances, or any combination of substances, polysubstance use, and can be accidental or intentional. Proper and timely emergency response can temporarily reverse an overdose and save lives. CNS. The brain, spinal cord and optic nerves, controls and registers thought processes, movement and sensations in the body. Psychoactive substances, legal and illegal substances that affect mental processes, thoughts, feelings, behaviors, does not necessarily imply abuse or dependence. Pharmaceutical manufacturers have strict quality control measures. Producers of illegal substances do not. There is no way of knowing what is in an illegal substance or how potent it is. Often, the illegal drug supply contains traces of other substances a person may not be aware of, for example, fentanyl or carfentanil in a substance sold as cocaine or ethamphetamine. This increases the toxicity of the drug. In this example, these opioids may be more than the person's body can tolerate, causing opioid poisoning. These are the signs of opioid poisoning, then click Next to learn more. Slow or no breathing. Unresponsive to voice or painful touch, can't wake them. Pale face. Blue lips or nails. Gurgling or snoring, choking or vomiting. Cold or damp skin. Constricted, tiny, pupils. Stiff body or seizure-like movement. Please note. Naloxone does not work for other drug overdoses or poisonings. If you administer naloxone to someone who has taken amphetamines, stimulants, benzodiazepines, etc., it isn't going to do any harm. However, it isn't going to stop those types of overdoses, so it's very important that you call EMS immediately. Opioids can be prescribed by a doctor, as well as used for recreational drug use. Opioids are psychoactive substances. They are primarily prescribed to suppress pain, and may also be used to suppress cough, relieve diarrhea and produce a sedative effect during medical procedures. Both legal and illegal opioids can also be used to produce feelings of euphoria, or intense pleasure. They are derived from the opium poppy and created synthetically or semi-synthetically in pharmaceutical laboratories to make opioid analgesic medications or clandestine laboratories for sale on the street. Common pharmaceutical opioids include fentanyl, morphine, hydromorphone, oxycodone, codeine, methadone, carfentanil, and diacetylmorphine, medical heroin. Street versions of opioids include heroin and fentanyl. Opioids bind to the opioid receptors in the central nervous system, CNS, and parts of the gastrointestinal system. Short-term effects of opioids include pain relief, euphoria, drowsiness, respiratory depression, slowed breathing, slowed heart rate, trouble concentrating, nausea and vomiting, constipation, itching and involuntary muscle movements. These effects depend on the dose, frequency of use, method of administration, or if they are used in combination with other substances that depress the CNS. Frequent use of opioids can result in physical and psychological dependence, which can lead to repeated use and increased risk of poisoning, overdose. For those who are dependent, stopping use of opioids can produce withdrawal symptoms of cravings, runny nose, sweating, restlessness, nausea and vomiting, diarrhea, body ache and muscle spasms, chills, and irritability. Carry a nasal spray and follow the instructions in the box.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your Naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about Naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So, you've called 911 and grabbed your Naloxone. Now what? This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal at the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, Kevin, can you hear me?
Check for signs of an overdose. Seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into 1 nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children.
In this scene, there are many things a responder may need to pay attention to or check. Look at the scene and click on the things you took note of in your assessment. There are 3 key findings to uncover, but there may be more than one way to uncover a key finding. Hint, your cursor gives a clue. Click on X to close this message. You have finished this course. Thank you.